Hello, this is Jonathan Munoz, and today I bring you this invitation to the Urgent Care Updates 2022 by the Mayo Clinic. But first, let me explain you what is urgent care. So, urgent care is a branch of medicine, of internal medicine or family practice. Let's say you are an internist or internal medicine doctor or a family practice doctor, and you don't want to work on inpatient medicine, you don't want to work on inpatient medicine, meaning that you don't want to work as a hospitalist, nor you want to work as an outpatient primary care doctor. You want to be able to see patients, not to have a relationship, treat their problems, and go back home, not taking any work to home, not taking any commitments. So that is urgent care. You basically work at a different setting office where your goal is to assess a patient's acute problem and determine if this is um, mild and you are able to treat with oral antibiotics, with simple remedies, or if this is severe, life threatening, and you have to do a transfer to the emergency department. You have to ultimately recommend that the patient needs emergency department care with MRIs, blood work. The urgent care, think of it as me, Jonathan Munoz. I have uh, a company where we have primary care doctors, where the doctors are going to be your family medicine doctors, that we are going to be the ones that take care of you from age 0 to age 100 years old. Um, but urgent care is a different office where I have also a chest X-ray machine. I have some more supplies to do sutures, to take care of wounds, and maybe able to provide some fluids, intravenously fluids, and do some to place a cast, to maybe remove a foreign object from your ears. So that is an urgent care. There's no relationship, just you go there, get what you need to get done, and leave. That's an urgent care. And why it's important? Because there are things that are inherent to that line of work and procedures or diseases that are unique to that line of work. So you have to get to know this. Um, so that's why many doctors or many residents that are going to finish residency and don't know what to do, they think urgent care will be the way for them. They need to do a little more of work on getting exposed to what is urgent care. So on the last year, they request elective rotations at urgent care clinics so they get to know what is it all about. So let's look at the urgent care updates for 2022 provided by the Mayo Clinic. Day 1, outpatient management of acute radiculopathy. So how are you going to manage a patient that comes to your office with acute radiculopathy? What can you do or give in the urgent care? Usually we can give in intramuscular steroids, intramuscular pain medications like Toradol, which is one of the very popular ones today. Um, we can also suggest for a patient to look into an MRI, but we cannot do it in the urgent care. We can also suggest for them to be transferred to a pain management specialist, but that has to be done through the primary care doctor. Um, Next one, heat-related injuries, something to look into. I don't know much about it because I don't practice urgent care work. And then acute abdominal pain, of course, you have to determine if this patient has acute appendicitis, acute cholecystitis, and if this vomiting and nausea is because of acute appendicitis. Sir, you have to go to the emergency department and have your appendix removed. Vaginitis, very common problems. This is one of those problems that is not severe enough to go to the emergency department, but it's not mild enough to not to do something. So vaginitis, how do you diagnose vaginitis? Pneumonia, treatments of pneumonia, how to differentiate them, stratify them, and give treatment, oral treatment for home. Then atrial fibrillation, capturing or worrying about atrial fibrillation. What do you do? What's the treatment plan? What's the workup plan for a patient that you in your urgent care clinic did an EKG and found that the patient is on atrial fibrillation? What is the treatment? The treatment is, as you probably know, is to continue monitoring telemetry, confirming that this is paroxysmal atrial fibrillation, then evaluate for causes for atrial fibrillation like TSH, intoxication, history of drugs, an abnormal cardiomyopathy on an echocardiogram, a repeat EKG, and then after that, starting anticoagulation, start beta blocker therapy, and are you going to at some point do cardioversion? Are you going to use different medications like digoxin, beta blockers, calcium channel blockers, or is this patient more severe and needs a different medication like a amiodarone? Okay, let's keep moving. Then this is a round table where you are able to ask questions. Febrile seizures. What do you recommend a patient that brings their son with seizures and he has a fever? Do you feel confident that you're going to say, oh, all my studies said that your daughter has febrile seizures, nothing to do? Or are you going to send this patient to the emergency department? So knowing this helps you make that decision. Hypertension emergencies, always part of the daily bread and butter cases that present to the emergency department. Pharyngitis and sinusitis, very common. Concussion, a very important topic to make a differentiation, to make recommendations, because these are the cases that come not only to the urgent care but to the outpatient's office. Evaluation and management of acute ankle foot injuries, MSK. You need to know the basics of foot injuries and MSK injuries. This is something that will impress your attending if you're doing a rotation in an outpatient clinic. The maneuvers that you do and how you explain that you determine that this patient has an ACL tear based on the maneuvers that you did, and what's the next step, and what is the pain management, what is the recommendations for home rest. Suicidal ideation, what are you doing, or what are you going to do if you are at an urgent care and a patient comes complaining of trying to kill himself or having ideas of killing himself? And the answer is those patients always go to the emergency department. Next one, learning how to use steroidal creams in the management of rashes, identifying rashes, infectious versus allergic rashes. Anxiety, how are you going to treat anxiety? Is that okay that you prescribe benzodiazepines to any patient that comes to you? Can you, not being the primary care doctor, start a patient on a medication like an anxiolytic like Prozac or sertraline? Are you the one that is indicated to do that? Or it has to be the primary care doctor? It has to be the primary care doctor because there is a need for follow-up with these medications. Skin infections, you need to know some skin infections. You need to know all of them, and you need to identify viral rashes, rashes that come as a part of a respiratory viral infection. Next one, knee injuries, headaches, suture techniques, and oh, there is more. When mammals bite, animal bites, very common cases that present to the urgent care. What to do? So you could grab one of these ideas, do a one-page presentations, what to do, what's the antibiotic of choice for example, animal bites. Acute asthma exacerbation, another reason why patients go to the emergency department, not to the urgent care. Sorry. UTI in the elderly. Is everything that has pyuria in the elderly a UTI and needs antibiotics? The answer is no. Legos, bags, and berries. Oh my! I think this has to do with choking, but I'm not sure. Acute COVID-19 infections, sexually transmitted diseases, and radiology, some radiology, and the conference is done. So, if this is of your interest, you can go to the website, look more into the titles, into what is happening on this conference. You can learn more on your own, make a presentation, make a couple of slides or a paper presentation to your attending, and you surely will impress, because these things, these topics, are things that we need constant refreshments. We need new information coming to us. And if you are able to synthesize that for us and bring it to us, explain it super quick, then you have saved me a lot of time, and I will appreciate that and give you a good letter of recommendation.